The Journal of Patient Safety estimates that there are between 210,000 and 440,000 patients each year who go to the hospital for care and suffer some kind of preventable harm that contributes to their death. That would make medical error the third leading cause of death in the U.S.
Hi, Sally Quaid. How are you doing today? I'm gonna check your vitals. Okay, your pulse is normal. I'll check your temperature. Your temperature is normal. You look like you're doing pretty good today.
Hello, Tracy. How are you doing?
Good. How are you doing, Dr. Othman?
I'm doing great. How's your shift today?
It's long. I'm working a double today, and I've already been here 10 hours, and so I'm starting to get a little sleepy.
All right. You'll make it.
Yeah.
So how's our infant here doing?
She's doing pretty good. All her vitals were normal. Here's her chart.
All right. And so you'll need to get the patient hep block.
Okay.
So here's the prescription.
Okay. I'll run to the pharmacy and get that right now. Thank
All right.
you.
Have a nice day.
You too.
Hey Tracy, what can I do for you today?
I need a prescription of Heplock filled, please.
Alright. Let me go in the back and get this for you real quick.
Okay, thank you.
Alright, 10 units of Heplock. Alright, I just got it all ready for you. Here's your
Okay.
prescription, and here's your paperwork.
Thank you.
Have a good day.
You too. Okay, it's time for your medicine. Okay, that should make you feel better. You still doing okay? Let me check. Oh, you're bruising. You're bleeding a little bit too. Let me get the doctor. Dr. Othman, the patient in room 103 is having an adverse reaction to her medication.
What kind of reaction?
She's bleeding out through her IVs, and so I think she needs some attention.
Okay, let's go take a look.
Okay.
Let's see. Okay, this is not normal. Do you have the medication?
Yeah, it's right here.
All right, this is heparin. You're supposed to give the patient hep block. This is 1,000 times stronger.
Oh, there must have been a mix-up in the pharmacy.
All right, you need to go get protamine sulfate right now.
Okay, all right.
In 2007, Dennis Quaid took his 2 infant daughters to the hospital for a staph infection. To treat this staph infection, the nurse was supposed to administer 10 units of Heplock, a child's blood-thinning drug. But instead, the infants received 10 units of heparin. That's 1,000 times the recommended dosage. Thankfully, the issue was resolved before fatally injuring the infants.
Color. Each of the drugs should have clearly different color coding. Since the accident, the manufacturer has added a red caution label to the bottle that must be removed before its first use. Shape. Not only were the labels color-coded almost identically the same, but each of the drugs should be distinguishable in both size and shape. Name. Although the names were similar and might refer to a specific chemical compound, they are still confusing since they both start with Hep. A suggestion would be to have a name that indicates the category of people the drug is made for. For example, Hep infant versus Hep adult could have clarified the use better and possibly prevented some of these cases from occurring.
Another factor is the exhausting hospital life. A common problem in hospitals is having too long shifts where doctors and nurses do not have enough sleep between their shifts. This lack of rest can increase the rate of human errors. Lack of error check-in at some hospitals is yet another significant factor. When the human factor is involved, there is typically more error. Therefore, it is highly recommended that nurses double-check which drug is being used. We recommend that a computerized system is in place to interact with each case. When a wrong drug is prescribed, the computer will send a warning signal to indicate a potential error.
Pharmacy's error prevention. The pharmacy should also have a computerized system that is linked with the hospitals. When a doctor writes a prescription, it should be linked to a barcode, which are looked up by the pharmacist. The pharmacist would then have to scan the drug so that the computer can check whether it is the right drug. A simple system such as this could prevent many errors from occurring in the future.
Didn't work first go.
Let's see. This is not normal. Do you have the medication?
Yeah, it's right here.